everyone, it's Dr. Chen from LUMEBOX. A lot of people have requested to see my skincare routine, so I'm going to break it all down for you today. I'm going to share my morning routine, evening routine, and how I incorporate my much needed LUMEBOX into my skincare routine. Let's get to it. So I generally like to use my LUMEBOX in the morning, but you can totally use it in the evening as well. So what I usually do is when I wake up, I wash my face with jelly cleanser, and then a vitamin C serum is a must for me every single morning. So right now I'm enjoying this one by Dr. Yoon. This one has a vitamin C and E together. These two are synergistic antioxidants. And what antioxidants do is that they help to fight free radical oxidative damage. And these are kind of compounds that age our skin. So they help to mitigate those damaging particles. So I always use vitamin C, either this one or something else. I also like this one by Osea, which is the anti-aging serum, which has a stable form of vitamin C in it as well. Now, the key with vitamin C is to find a preparation that is stable, because a lot of the time I see people using their vitamin C and it's already brown. And if it's brown, it's probably oxidized. So after my vitamin C serum, I will use a moisturizer on top. So currently, I am using this Day Glow oil from Osea on top. I love this oil. It's great for building skin barrier. If you don't like an oil, you can use a light moisturizer of your choice. Now, I don't put the sunscreen on until I've done my LUMEBOX. After I put my moisturizer on, now I go to my desk and then I put the LUMEBOX on my stand. I put it in red mode. And then I put it on the stand. We provide goggles, by the way. If LUMEBOX is facing your eyes, we recommend that you use goggles. Obviously, it's up to you if you use it or not, but we do provide them for you. I'm not looking at it directly because I don't have my goggles right now, and it's super bright. But I will usually sit about 5-6 inches away from the light, and it's facing me, and it will usually cover my entire kind of face and neck area. And it's really important not to forget about your décolletage, which is your neck and kind of upper chest area, which can age just as much as the skin on your face. So while you're doing your products on the face, make sure to do a little bit on your neck and chest as well. So usually when I'm doing my red light therapy with LUMEBOX in the morning, I will habit stack and do a 5-6 minute meditation or breath work. This helps to really set the tone for the day. It increases my productivity. It helps me elevate my mood, elevate my energy level, and all at the same time as rejuvenating my skin. So red light therapy, if you don't know, has been shown in studies to help improve the appearances of wrinkles, blemishes, and scars. And that's why I love it for my skin. So now that I'm done with my red light therapy, I will go put my sunscreen on and I go about my day. Now, what do I do in the evening? In the evening, I usually will take off my sunscreen, any makeup I'm wearing with an oil. So right now I'm using this oil cleanser by Dr. Yoon. There's so many different oil cleansers on the market. Just pick the one that you like. This one melts the makeup away, and I really feel like it cleans sunscreen really well. And it's really important to clean, like kind of remove your sunscreen thoroughly, because otherwise it can really clog the pores. So after I've removed my sunscreen and makeup with oil, I will follow up with another cleanser like this one, the Gentle Jelly Cleanser. You don't have to use this one again. Choose one that you like. But what I like is the double cleanse, which is an oil followed by kind of like a foaming type of cleanser to really take everything off and prepare your skin for sleep. After I've cleansed, at night, I like to do an active. So whether that's retinol, and retinol has been shown in studies to help improve the appearance of wrinkles because it's speeding up that kind of cell turnover. And it's also been shown to support collagen as well. So there are 2 retinol products that I'm rotating between right now. One is this retinol cream by Dr. Yoon and Collagen Dream Night Cream. So this one has a bioretinol. So it's not your kind of normal retinol, and that's why it doesn't require the usual preservatives. The problem with retinol is that it's not stable and usually needs a lot of preservatives to make sure it doesn't break down, because once it breaks down, it's not active anymore. So a lot of retinol preparations use BHT, BHA, which are endocrine disruptors, to preserve the retinol. Not a fan of that. So Osea doesn't do that. They have a bioretinol, which doesn't require those preservatives. And also they have peptides as well. So I use a retinol at night, and 2 to 3 times a week, I will also use AHA, which helps to remove any dull or dead skin cells, which really helps to reveal kind of younger looking skin underneath. So this is the one that I love and use twice to 3 times a week. The Sea Glow Overnight Serum, it has AHA. AHA helps to lift off any dead skin cells. This combination is actually really lovely. So twice to 3 times a week, I will use the serum first, followed by OCN night cream, or I will use this by itself. Now, my skin is actually quite adapted to retinol, and I don't have any issues with redness or dryness or irritation. But if you're new to retinol, some people can get quite dry and red and irritated. So just be aware of that. If you're new to it, I would just go slowly, like maybe once every 2-3 days, apply your retinol, just see how your skin goes. A lot of dermatologists also say don't use red light at the same time as having a retinol on your face. And the reason is because both these products act on the same mechanism in the skin to help rejuvenate, which is to increase cellular turnover and to support collagen. And you know, when two things are doing the same thing, there's a risk that it may increase irritation and the redness and dryness. So if you do use a retinol, I usually suggest to space it out. Of course, some people are going to be okay with both together. I don't know your skin type. Everyone has different skin types. That's just a general recommendation. That's why I use my LUMEBOX usually in the mornings, because I use my retinol at night so that I can use my red light therapy in the morning. Now, sometimes I forget to do my red light in the morning because I'm busy, and I will do it at night. But then that night, I probably wouldn't use my retinol. I know a lot of people who say don't have any products on your face when you're using red light therapy. And that usually is because if you're using something like one of those masks with the lights, those devices are touching your skin. And if you have products on, it's going to rub off on those masks. And also those masks are quite weak in power, and that's intentional because your skin doesn't actually need a lot of light. So if you have something literally touching your skin and you make it super powerful, your skin might actually be getting too much light. That's why I say to position the LUMEBOX 5-6 inches away from your face, because that's the kind of right distance to deliver the optimal amount of light for your face, for your skin. Because LUMEBOX is so powerful, distance actually helps dilute that power. And for most people, 5-6 minutes is enough. But if you're using a kind of lower powered, weak mask, then you want it much closer to your face. You may not want products on your face because it could actually, prevent it from working as well. I personally always use products with my LUMEBOX and not have any issues. The only thing I would avoid is a retinol or a sunscreen, because sunscreen can actually block the effect of red light penetrating through. Now, the reason why I made LUMEBOX so powerful is because it's not just useful for the face. I can put it further away so that it's good for my skin, but I can bring it closer if I'm using it for example, the joint, which does require more power because, for the light to penetrate down to that joint, you need a decent amount of power or irradiance or dosage of light. And if your device is weak, it's just not going to penetrate down. So I made LUMEBOX powerful so that you can use it for everything from face to joints to you name it. I hope you've enjoyed this video. Let me know if you have any requests for other how to use or my routines. I'd love to hear from you. So drop any requests in the comments below. And be sure to subscribe to our channel to get more videos like this, where I teach you how to use red light therapy.